Hi, this is Tom Shanahan. I am the author of Spiritual Adrenaline, a lifestyle plan to strengthen and nourish your recovery. And I'm really honored to be joined by one of the people who was a founding father of the sober active movement, along with his wife, Sheena Archuletta. I'm joined by Rob Archuletta, who more than a decade ago started a group called Addict2Athlete with just himself and his wife and a couple other people running, back from meetings. And now, more than a decade later, it's an organization that's helped to save and improve thousands and thousands and thousands, if not tens of thousands of lives. So he joins me this morning, and we're here to talk. Thank you, Rob, so much. And we're here to talk about what's happening with the coronavirus. And Rob brings to the table a very unique portfolio of experience. Number one, obviously, as a person in recovery, which he's very open about. Number two, as a co-founder of a sober active organization, Addict2Athlete, but also as a treatment professional who is also a doctoral candidate. He's almost finished his work, the credits that are required, and he has still his thesis to go, but he's a doctoral candidate in addition to being a vice president at Crossroads Turning Points, Inc. in Pueblo, Colorado. So, Rob, thank you so much. Thank you to Crossroads for allowing me to do this today. I really appreciate you being here.
Yeah, so I'm one of the chief officers at Crossroads, not
Oh,
vice president, but that's okay. That's
sorry
okay.
I don't know if I demoted you or not, but thank you for thank you for clarifying. That's a Rob.
Yeah.
What's your message to people out there, both in the recovery community and the general community, about what's going on right now?
Well, my first message is to remain. Everybody knows the things that make themselves happy, and so to just modify those things if they have to do. What worries me about this whole thing is that people have just kind of stopped doing everything. And that's kind of that knee-jerk reaction that we have sometimes. But with people in recovery and people that struggle with mental health or that have anxiety, when you just stay inside and you isolate yourself, it's dangerous behavior, just as dangerous as the virus is. So my message to them is, what makes you happy, what makes you feel healthy, modify it, practice social distancing, but keep moving forward. Don't just stop everything.
Great, that's great advice, because I think that the more time I spend in the house without getting out and just breathing some fresh air and maybe seeing some green, some nature, the crazier I get. What about the TV? Having the TV on these days? So when you're home and you're social distancing, people are watching TV almost all day. Any thoughts about how that might impact their mental health?
Well, so something that's funny for sure, your physical health, right? I had a friend that posted something on Facebook, and it was like a modified picture. It was like the dude from Motley Crue in the 80s, and it said my first day of quarantine, and then it was him now, which obviously he's gained a lot of weight, and it said 30 days later. And that is dangerous, right? Like, I mean, even as active as I am, just staying in the house, not having the gym open, not being able to go get my haircut, all those things that just get us out of the house. I do find myself like snacking more, staring at the TV more. And so what I've had to do is I've had to just set a schedule of things that I could get out of the house and do, because it is easy to just sit around and do nothing. And like the whole active recovery movement is about get out, get moving. If you're just sitting in the house watching TV, you kind of fall back into those behaviors. What's scary is those behaviors, once we engage in them, just like falling off of, eating healthy, it's going to be hard to reel that back in when this is over.
You're 100% correct about that. So people out there who maybe aren't part of the community that we're part of, the sober active or active sober community, what are the benefits for them using this time to get started with a healthy routine, some kind of exercise during this crisis? What are the benefits?
Yeah, so one of the things I did is I implemented a challenge on Facebook, and it's called virus challenge, down with the sicknesses, hashtag down with the sickness. And it was a 5K for 5 days, a 10K for 10 days, or because COVID-19, 190 burpees a day. And one of the things that I've seen is people that normally did CrossFit, or people that normally just came to the gym, or that were sitting on a spin bike at home, which all those things are great. But some of these people are posting this one girl said on the Facebook challenge page. She said, I'm becoming the runner I always wanted to be.
Wow.
And she was like, you know, I'm afraid to post my time because I'm embarrassed. And I said, post it. You don't realize that you're inspiring other people. And she's never walked or ran over a mile, and she's already done 3 5Ks. So it's actually having that reverse effect. She's engaging in something that she's never done, and it's creating a habit that hopefully she'll stay with. And it's also showed her that she's capable of doing things like that she's never done before. It's not as hard as she thought, you know? And so hopefully people stay in that.
Well, let me just ask you, how can they participate in this group? And you said it's hashtag. Why don't you just repeat the hashtags and where they can go on Facebook, so that if people are out there saying, hey, I want to try that. And by the way, I heard you came up with a plunger workout.
Yeah.
I haven't seen that yet. But so if people are interested in doing this, because this is critical, this will save lives, this will inspire people to not live in the chaos, where should they go?
Yeah, so you could just go into Facebook, in the message, type out hashtag virus challenge, hashtag down with the sickness. Our gym is Stay Invincible Colorado. Everybody calls it sick, SIC. So down with the sickness, and sick is spelled SIC. And you know, it's also about maintaining your sense of humor and having fun, you know, and I started calling myself, and doing messaging on Facebook. I started calling myself Miley Virus, and just sending out funny messages. I know this is a serious time, but we can't be so serious that we can't still have fun and be ourselves.
Let me ask you a question about that, because I think part of what makes recovery work is when people in recovery share the ridiculous stories about their prior behavior, and people crack up. We all crack up. We laugh at ourselves.
Yeah.
And we know it's serious, but we laugh at ourselves. So as someone who's been there and lived it, but also as someone, again, you work with hundreds of patients at Crossroads Turning Points, Inc. So what is the import, both as a person, but also as a professional in the field, of maintaining a sense of humor during these really challenging times?
Well, yeah, I think there is. Some of us were around during 9/11, and that was very serious, right? Addiction doesn't stop. It's not like everybody that is struggling with addiction, where their basic need is to keep using or keep drinking. It's not like we just, like, the people are just stopping. They're like, oh, coronavirus, you know, and some dude's walking out of a house where he sells drugs out of, and he's like, hey guys, we're practicing social distancing. I'm not selling drugs right now. That doesn't happen, right? They don't care what the CDC says. They're going hard.
They weaken their immune system, right?
Yeah, right, yeah. Hey guys, I'm really looking out for you. No heroin today. So they're still moving, right? And so we got to keep moving in the active sober movement. But about having a sense of humor, right? A lot of people in recovery have already faced death. They've already, you know, or they're struggling. They've already got HEP. They've already got that stuff, those things. So they've already faced this. So this isn't as intimidating to them, but they also know that addiction has killed more people than this virus is going to kill. And so maintaining, staying vigilant in the things that keep you healthy, but also have fun. Still have fun and joke around. Somebody posted a Facebook post, and I shared it, and it was a guy wearing a Norton disc from back in the day, and he had a Norton antivirus disc with a rubber band over his face. And I thought it was funny, so I shared it, and several people messaged me and like, how could you be laughing about a virus that's killing people? It's not that I don't take it serious. I'm just reminding people that life is already fragile. Have fun while you're in it. You're not sending a message of, I don't take this serious. You're laughing and having fun, saying that, hey guys, you know, we're all at risk every day of our lives. This doesn't change. Let's still have fun, and let's still joke. So if you've ever been to a meeting, people say funny things. Like, I remember I was at a meeting one time, and this guy said, hi, I'm Jeff. I'm a retired carpet farmer. You know, and those of you guys that don't know, carpet farming is like when you're looking for dope on the floor. And I was like,
I didn't know that. That's hilarious. I didn't know.
Yeah. So he said he was a carpet farmer, and I'd never heard that. I thought it was hilarious. It doesn't mean that I don't take what he's gone through seriously. It just means that he's laughing, and it's okay to say, hey, I was crazy. Now I'm sane.
I hear you 100%. So let me ask you though. I want to transition now to your role more at Crossroads Turning Points, and because I went to rehab. And when I was in rehab, one of the things that was encouraged, I went to Conifer Park in upstate New York, was the socialization component. And then also one of the things they told us was critical for long-term success was when we were discharged was to really socialize and, that component, go to meetings, and do fellowship and these kinds of things. So we're in the new reality now. So how are you as a treatment professional dealing with the inpatient population? And then also, what recommendations do you have, or what are you recommending to your outpatient population, but also for people who are out there in the community now on the new reality and how they can maximize their chances of remaining sober, being happy, and avoiding relapse? Because I do not believe relapse is inevitable, even with all the crazy stuff happening in the universe today. I don't believe it is. So what's your advice to them as a professional?
Well, the funny thing is, some of us that have been in this movement, we talked about this yesterday, is everybody all of a sudden, all these scientists and doctors are like, the cure for addiction is connection. Well, like those that did support groups, we already knew that. So thank you guys for making us aware of something we've been aware of for years.
Right.
Now you're calling it evidence-based. Thanks. We're good looking out. And I'm just joking when I say that because I'm guilty of it too. Somebody like me in 10 years is going to be like, Rob wasn't that smart. I knew that 20 years ago. But the infrastructure was already set up, and things that I was against, like I don't love those Peloton bikes. I don't love those things that keep you in the house. I think those things can aid you when you can't get out, because I think there's already enough reasons to stay home. Netflix and chill, YouTube. There's so many things that keep us at home already, but because of those things, we've already been set up. The infrastructure is there to stay active and to stay connected, even without seeing each other in person. Mm-hmm. So now those things that I didn't love at first have become like tools to keep us all sober, to keep us all healthy, to keep us all engaged. I still feel connected to the people like that are posting on the virus challenge, or the people that are on Facebook and Twitter and Instagram. I still feel connected to them. So the people that normally just stalk and don't post what your workouts are doing. Post your struggles, join a support group that is a private online support group. Stay connected, because you do still feel connected when you're sharing pictures of yourself, when you're sharing pictures of your dog, when you're saying, hey, I got out and walked today. I got out and ran today. Not only is it encouraging, but it also keeps you accountable. That's why people post pictures of their food that said, hey, I ate a salad today versus I ate a hamburger. Hey, I walked with my dog 2 miles instead of I stayed home and watched 100 episodes of Breaking Bad and now I'm triggered. You know what I mean? So
question about that though. The young lady you referenced earlier, who took part in the challenge and has won, and she was afraid to share her time. We're all like that, right? We're all our own worst enemy in that respect, not seeing the positives, but comparing ourselves to other people. So what's your message to someone out there who maybe is following the challenge or trying to integrate these things, but it doesn't want to share about it because they're nervous on what other people will say?
Well, first of all, I'll say this, like a big part of recovery is being transparent. Do you know what I mean? We only lie and hide things when we're ashamed of them. And I think that that's like an unhealthy mentality when people are afraid of that. So I say anything you're doing positive, anything you're doing, you might think that, but share. It's experience, strength, and hope, right? You're sharing your experience, your strength, and your hope. And so when you post that stuff, there's somebody that's not as fast as you that's like, hey, if she posted her time or he posted his time, I'll post mine, I'll share this, right. I'm guilty of that too. Like, right. I don't really lift. I'm a cardio guy. I don't post my 150-pound deadlift and brag about it. But, now I might do that if I had, the ability to deadlift, just to say, hey, I'm deadlifting. I'm doing something. I'm out there staying active. You're inspiring. We don't realize that, but we truly, truly, truly inspire people and inspire each other. And any little thing that you're doing positive at this moment, at this time, it means a lot. Pictures of people's dogs, pictures of people with their children, pictures of people saying, hey, I did insanity today in my living room, and they have their headband on, and it's full of sweat. Those things are inspiring to us right now. They used to be annoying back in the day. Like, we get it. You work out. Don't share anymore. But, but now it's turned out to be something that's inspiring.
I agree with you. And there's so many people, as you know, at Spiritual Adrenaline, we share people's stories. That's basically what we do. And we focus
Yeah.
on people who have succeeded in the integration of exercise and nutrition. And so many people come to mind that 3 years ago, when they first got sober and they started down that track, were overweight or this or that, had health conditions. And just by working out and integrating that healthy lifestyle into their recovery and working with their doctor, of course, they've had results beyond what they thought they can do.
Yeah, yeah.
Talk about that for a minute, because this is a critical time. This is a time where people are at home. They have the opportunity to focus on their own health, right?
Yeah.
And this is important because your immune system will be stronger if you exercise and if you provide your body with the nutrients it needs. So let's just talk a little bit about what Addict2Athlete does and what are the benefits of, the people that you've seen come through the program over the years. Give a couple of examples so people won't say, hey, this guy's got it together, but I'll never get there. Give a couple of examples of people who have come through the Addict2Athlete program that are just, inspiring people all over the place.
Yeah. So first I want to say this really quick, Tom, before I forget to say it, is hats off and to all the treatment providers that are still open, all the residential units, all the detoxes, all the withdrawal management systems. Those people working in that environment are on the front line, and they're so important to our society right now. Instead of just letting somebody spread the virus sitting in an alley with nowhere to go, the detoxes are open. They're working and communicating with the hospitals. I think that's important, and we could get back to that. As far as the examples, like, my wife runs Addict2Athlete now. I've stepped away from it, but she has several coaches. I don't think he'd mind sharing. One of my buddies, Todd Smith, is somebody who had died withdrawing in jail. He came into the program.
Yeah.
And the reason I pick him to share is because you have a story that you could share about him. He came into the program. He couldn't really lift weights. I definitely was a mentor to him, showing him, this is how much weight you could lift. This is how hard you could push yourself. He came in, he would always say, like, I died in jail. I don't want to push it too hard. Now at this point, Todd is super fit. I think you said he's one of the most attractive men in recovery that you've ever seen.
Let me get it right. So all my gay friends in New York, when we ran his interview on Spiritual Adrenaline's blog, reached out to me and go, that is the absolute hottest man in addiction recovery.
Yeah. So
he is.
So
inside and out, though, when you get to know him, oh my God, what beautiful on the inside. Yep.
Yeah. So my message to them is, I'm the hottest guy. Todd's number 2. No, I'm just kidding. But seeing Todd and you seeing his pictures now and seeing what he's done, he mentors me now. He's the one standing at the edge of the weightlifting platform now, telling me, you got this, you could lift heavier. I can't beat him at anything now, unless maybe it's a long distance run that he's not interested in doing. It's totally switched. He is the mentor now. He's the one setting the example for people. And so everybody starts somewhere. You know what I mean? There's that quote, a journey of 1,000 miles begins with one step. During this time, you could take that step. During this time, you could take that step by getting out there and doing 1 mile. Things that seem, I'm a 5-time Ironman. I remember doing my first 5K. I was like drinking coffee. I had goose, a camel pack for a 5K. I'll run 13 miles today and I won't take any water with me.
Yeah.
But you don't know what you're capable of until you get out there and do it.
God bless you, man. I mean, that your message is sorely needed in these really challenging times. So we're going to kind of wrap it up. So I'm curious, what message do you want to leave people out there who are watching this video with during these again, we're in a crisis. What's your message?
So one thing I always say this is the Addict2Athlete uses the 5-pointed star, right? And their message is, spirituality, society, service, and fitness, and remember those things, the things that keep you healthy. Remember to do those even when you're in your home. And then Dr. Cornel West said, the cure for addiction is love, courage, and conviction. And I think that's what we need right now, is we need to have love each other, love yourself, courage to do the things we've never done, get out there and walk, do a 5K, share your pictures, the before and afters, and then conviction. Stand by what you say. You say that you're about recovery. You say you're about fitness. Get out there. Have the conviction to do what you say. Don't slip back into those old behaviors. It's easy to stay stuck in your house. Have a plan to stay active. Do things around the house. Hang out with your family and your loved ones, the things you may have never had time to do. Don't make this a time of arguing and trying to scramble to do things around the house that you've never done. Also take time to enjoy each other, get out, take a walk, if the weather permits. But, just having that love, courage and conviction for each other. And also remember to just keep thanking, like I said, thanking the emergency rooms, thanking the hospitals, thanking personnel, because those people are out there. They're on the front line. They have children just like we do. My staff at Crossroads, wearing safety glasses, they're wearing masks, they're wearing gloves, but you know what they're doing? They're out there, they're saving lives, they're treating people, they're helping people. So just remember that, as frustrating as this is, and I really feel for small businesses right now because they're shut down. Like my barber is shut down, my tattoo artist is shut down. They're not out there, they're not making money. They're not out there providing the service. And so remembering to support them, don't forget to go order food on Grubhub if you could afford to do that, and keep those businesses afloat. I wish you could get a virtual haircut, because I definitely would do that right now. But just remember to be kind to each other, and really even getting on Facebook and thanking people that are working in treatment, that are working at the hospitals, that are working at the emergency room, and saying, hey guys, thank you for staying out there. Thank you for providing those services. Like I said, all the staff at Crossroads Turning Points has been amazing. They have their head down, they're protecting themselves, but they're showing up for their shifts. They're serving people. And honestly, it doesn't sound like, but you and I know they're literally out there saving lives from 8 to 4.
I agree with you 100%. So if people are interested in participating in the challenge you referenced earlier, let's go through the contact information for the challenge, the contact information for Addict2Athlete, and then the contact information for you and for Crossroads, if we could.
Yeah, so Crossroads is crossroadstp.org. We also have a YouTube page where we post stuff about treatment and what to do, and I'll continue to do that. My Instagram is Active Recovery 1. Sheena is Addict2Athlete at addict2athlete.org. And you could follow her. She's constantly posting stuff about Addict2Athlete, or join their Facebook page. And then I'm Rob Archuletta on Facebook, and I'll be sharing stuff and just other people's stories. And if you want to do the challenge, just go into your search bar on Facebook, type in hashtag virus challenge, hashtag down with the sickness, SIC sickness. And you also get a cool shirt if you participate in the challenge. There's women's tank tops, men's shirts. They're really cool. They have a skull on them and a gear, and the gear stands for always moving forward. And it says down with the sickness on it. And, we're just doing what we can. So I hope everybody out there continues to do what they can.
Awesome. Rob, thank you so much for taking time. My best to you, to Sheena, everybody at Addict2Athlete, your family, your mom and dad, who I know very, very well. And so please, I encourage people, if you want to take the challenge, reach out, try that challenge, challenge yourself during these times. And there's so much knowledge that you just shared with people from, living this life for over a decade. So I thank you for taking time out to help other people during these difficult times. And now you and I will follow up in the next week or so. Okay.
All right. See you later.
Thank you.